You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest is one of the pioneers of implant dentistry. In fact, probably the busiest implant dentist in all of Texas. He's been on the program before. He's got a stack of before and after photos and lots of stories. Dr. Steve McAnaney. Dr. McAnaney, welcome to the program.
I'm glad to be here, Randy. It's always a pleasure to come on, and you can call me Dr. Steve if you want.
You got it.
It's up to you.
Okay, good. Who's the typical patient? Like if you had to say there's a typical patient that comes in to get brand new teeth, upper and lower, supported by implants, who are they?
The typical patient are people that have broken down teeth, lots of root canals, cracked fillings, missing teeth, bad gums, bad breath. Their smile's just a wreck. And a lot of people today have realized that they reach a point in life. They've had a lot of patchwork dentistry for years, like my age and older, and they come to the realization, where am I headed? They just wake up one day and say, wait, there's another solution. So they see the show and say, wow, why am I continuing down this path of misery and no results, wasting all my money? It actually becomes a money pit at some point of no return when they can come in and get new teeth that they can really smile and function with in a day.
Now you say most of these people that you see have hated their teeth and gums for like 10, 15, 20 years.
You're right.
And they put it off.
Yeah, they put it off, You know, all of a sudden they realize they can't go out, or they don't want to go out. They can't go out and enjoy dinner, don't want to be around friends, maybe go to church. They don't date, they're having trouble. They want to get a better job. There's a lot of things, and just one day they finally think, well, they know it's their teeth. Well, they know they're not sure sometimes. And that's why one thing all these people that you're going to see in a minute have in common is they wish they'd done it sooner. I mean, they
finally of doing it sooner.
Yeah, they finally get it done, and they think, why didn't I do this sooner? I wish I had have. And many people, for different reasons, put it off, and they're just not sure. And they come in and we talk. I always let the person make the decision. I'm just there to be their coach or their advisor. They come in, they explain their different problems they have. And by the way, we mentioned that there's a lot of emotion, you know, a lot of crying sometimes. But it happens before and it happens after.
You say they cry twice.
I do too. But it happens before because they come in and we have a private consultation room, and they just, they reveal many stories about why they're where they are, a lot of regret, resentment, a lot of things. And they also talk about how miserable their life is.
You say you smile sometimes while they're telling you this sad story.
Yeah.
Why?
I smile because I see where they're going to be. Matter of fact, they're telling me all this hardship, and I'm kind of getting excited because I know, because I've seen it.
That's nice.
They're going to be a different person later, and they're going to look back and say, my gosh, if I'd only known sooner, if I'd only known, if I'd only made this step, now look where I'm at. If they can just figure out how to cross the other side, and that's what I'm there for.
I like what you told me in the green room. You said you ask every patient, you say, why do you want to do this? Or what are you trying to get from this?
Yeah. So I ask them, you know, they show up at the office. And one thing that's really important.
What do they usually want? Like, what's their big thing? They just want to be able to eat? Or they want to be out of pain? What is it?
Kind of two things. Yeah, eat and pain. Guys are generally wanting to eat. They want to eat that steak or whatever. And the women want to look better. They want to go out with their friends and what have you. Very interesting, though. The guys are a little macho. They don't want to admit, or maybe they don't know, that they're really wanting to look good, too. And then the women are just wanting to look good, and they don't realize that they've forgotten how to eat. So it's a crazy.
So the guy that didn't care the way it looks ends up liking the way it looks almost even more than the steak.
Yeah, so 6 months later, they got this new smile going on. Now they're going to the gym, they're getting in shape, they're getting good. The interesting thing is a lot of the men that are married, their wives, you know, the guy's kind of recluse and never wants to go out, doesn't want to do this, doesn't want to participate in things the wife wants him to do, gets this new smile. And now he's
they're going out to dinner.
Yeah, and it enhances the relationship.
Good.
Or it enhances new relationships. I've seen people get raises, new jobs, promotions, get a relationship, a better relationship, or improve their relationship in many different ways.
Because of the confidence and the attitude, or what?
It's the self-esteem. Pretty much all of the ones that come in, especially the women, it's an appearance, a self-esteem killer. They know. They just didn't know what to do about it.
You say people with bad teeth are judged.
It's not fair. It's not. Is it fair to judge somebody? No, it's not. There's something about teeth you can't hide. In today's world, I mean, let's look around. You can have no hair, some hair, colored hair, different shape, size, tall, skinny, whatever. But this is always here. You can't get away from it. And so...
You say it's an easy fix.
It's an easy fix. I mean, they come into the office, we do consultation, they decide what they want, and within, like, literally we start that day, if we can do anything, getting all the information, and within a week, 10 days, they have a new smile.
I asked you earlier off camera, I said, look, if somebody's watching this today, and you had availability on your calendar, but if somebody's watching this show right now, bad teeth, bad gums, next week they could have new upper and lower teeth.
Exactly.
Is that right?
Yeah, because I have a team of people that work with me. I have the master technician that builds the teeth, I have the anesthesiologist, and we do it every Thursday. Now we can move it around, but every single Thursday we're doing this.
This is what you do.
Not just one person, 2, 3, 4 people in that day. That's a long day for me. I'm getting old. I mean, that's a lot of work.
Okay.
But we make new smiles, like literally many in one day. And then, you know, because it doesn't take but a couple hours to do that, maybe 3.
Okay.
And then they're off and running. So the nice thing about the connected teeth, we call it same day teeth, whatever, no denture, you put it right on the implants. The next day you come in, it's amazing how little discomfort. I mean, yeah, it's sore, but they come back the next day, we check them out, they're ready to start eating a modified diet right away, no dentures, any of that stuff.
So really, no more dentures?
No more dentures.
Is that the future of dentistry as you see it?
I do. Look, it used to be people that were much older, but we're seeing a whole nother generation of younger individuals come in. They just let their teeth get away from them for whatever reason. Okay. Now, that's one of the things that brings up the emotion. People get they get all dug into why they're where they are. And I like to reassure them, it's okay. It's okay where you are, and the past doesn't matter. It's not important, but I can help you with your future. Because it's your decision. I'm just here to provide the services that I do. It's all about them. They're the ones improving their lives.
Are people financing this? Because I know insurance doesn't cover it, Medicaid, Medicare doesn't cover this. So a lot of people financing?
Yeah, most people do. We have multiple financing things. It's no different than buying anything else. Some people pay for it, some don't. Now here's the cool thing. So let's just say, you know, when they watch this show, many people come in and say, I want that, I want that, I want that, and for whatever reason, they find out that it's not possible. Well, guess what? We do something that pretty much nobody else does.
What's that?
We give them options. See, we give them upgrade options. See, the thing is, they know they want their teeth out. Then maybe they get some implants, maybe at least some implants. But eventually, as they go up the ladder...
So you can start them with a snap-in, snap-out set of teeth that are locked in.
Find what they're comfortable with.
As a more affordable option, and then move them up?
The key is meet the patient where they are, not where you want them to be. It's all about them. And so it's better to give them some hope with the vision of getting what they want than to give them no hope and send them out the door. So we always find something. Very few people don't get started somewhere.
Something to improve their situation.
Hey, getting those bad teeth out, feeling better. You know what's interesting?
What's that?
Just the psychological impact that they know those bad teeth are out is powerful. Now, what we put back in there, whether it be a denture, snap-in teeth, or the fixed ones, is another level of confidence. But it's kind of like this monkey off their back. Oh, I finally did it. I got them out.
Is that what they all say?
Yeah, and you'd be surprised, the ones that are diabetic or have high blood pressure, within just a few weeks, they're even in better health. It's amazing.
My medical doctors come on this program, the integrative functional medicine doctors, they're all saying if you have gum disease, it affects the rest of your body. There's an immune response.
Oh, it's terrible.
So they feel better. Anyway, I have to rush you a little bit. We're short on time. The photos. You brought some photos. What are we looking at?
I have quite a few. So let's start out with this one right here.
Okay.
You're going to see a tremendous change. So if we look at the first picture, you can see that, well, he's, he's smiling. But what's interesting, if you don't notice, if you're a dentist, you might not notice, you can tell he's making himself smile.
Okay.
He's trying. Matter of fact, we have to cheese them because they don't smile, because they never smile, because they don't want somebody to see their teeth. In the second picture, he's relaxed. He's smiling because he wants to smile. You can see the difference.
So this guy would have had a denture?
Yes, he would have had a denture.
Do they come in and actually say, I don't want a denture?
They do. A lot of people, even the older individuals like him, because all they remember is grandpa, grandma had dentures, grandpa wore them in his pocket, grandma put them in the cup, or they fell out, stuff like that. So the word denture, I wish there was another word, because it's just like nobody wants it, because it brings back memories of things that they saw. And
so this guy, by the way, can eat whatever he wants?
Yeah, they're connected. So the teeth are connected to the implants. Even the snap-on ones are really good, but the other ones, they're as close to natural teeth as you can get. So here's the thing: no more cavities, no more cracked and broken teeth, no more toothaches, no more gum disease, no more hot and cold sensitivity. Oh, and by the way, where I live in Texas, it's up by Oklahoma, everybody loves sweet tea. And I say, look, if you get these, you can just drink all the sweet tea. You can just eat sugar all day. It's not going to rot your teeth out. And they're like, oh, yeah, that's a good idea. I like sweet tea. So, you know, there's a lot of reasons to do it.
You say the most expensive part about this is the going out to eat and the trips and things like that.
So these people have been recluse, haven't been doing this and that. They've been really pushing it down on their lifestyle. Now, when they get this done, they're off to the races. They're going on trips, out with friends. You know, they get to eat.
Do they tell you this? Do they come in and say, well, I just got back from this place?
Oh, yeah. Yeah, the problem is once they get it done, it's getting them back for maintenance, because they're always gone somewhere.
They never want to see you again.
Right.
Because nobody likes going to the dentist, right?
I don't like to go to the dentist, so.
So we'll go to the next photo.
Okay, next one. So here's a great one here. I mean, look. Now this shows it up close. So you can see this person's just not happy. I mean, it looks like they're struggling to even to...
That's got to be unusual to have teeth that bad.
And why would you say that, Randy?
Well, I never see it.
Well, I see it all day long. It's out there amongst us. The reason you don't see it, because these people never smile.
Okay, good point.
But when they come into my office, we get to find it. So this is very, very, very common. Not just a little bit older individuals like this lady, but the younger people too.
How old can you be to do this?
You can be as old as you want to be.
What's your oldest patient?
92.
Why would a 92-year-old want to do this?
Why wouldn't they? Well, I'll tell you why this person did. They'd had dentures for years. Here's what he said. I'm sick and tired of being sick and tired of being sick and tired. I want to eat food. Even if I don't live for a few more years, I want to enjoy what I've got left. And sure enough, he did.
So on a 92-year-old, they're not more likely to fall out or things like that?
What fall out?
The implants?
Why would they?
So statistically, you could be 90 years old, doesn't matter.
Your bone will accept implants at any age, young or old.
So if you had a 70-year-old that says, I'm too old to do this, that's ridiculous.
It is ridiculous. Now, I do have some people that, for some reason, and where I live, people somehow think as you get older, you lose your teeth. And I'm like, well, why would that be? They just don't fall out as you age. That doesn't happen. And then they start thinking they're not. Another thing, very few people can't have implants. They because, like a lot of women think because they have osteoporosis, they can't have them. That's absolutely not true.
That's not true? Really?
No.
Okay.
Or people that...
But if you've been wearing a denture 20 years, you can't do this. You don't have enough bone. Is that correct?
That's not true.
Okay.
Now, have you heard that somewhere?
I have.
From who?
I've had dentists that say, well, Randy, you know, they don't have enough bone.
So let me level.
Is that just in the training of the dentist?
It's training or not knowing better. So
Okay.
I have people come to me a lot that's been other places that they said they didn't have enough bone, it couldn't be done. And I said, well, come on over. If it can't be done, I will tell you, because I can usually do it when other people say they can't. So with all the different inventions and the modifications and improvements in dental implants, we can put them in pretty much anywhere.
What if you have bad gums? Can you still do this?
I hear that one too. I guess you've heard it. So I have gum disease. How can I have this? Right?
Yeah,
I just ran into that the other day, by the way. They had bad gum disease, and we're talking about bone loss from gum disease, and they said, well, if that's so bad like that, how can I have this?
Yeah, it's a good point.
Well, here's the beauty. Gum disease is only present when you have real teeth. There's two ways to get rid of
gum. So the bacteria, what, lives on the root? Or
something like that, yeah, without getting technical, difficult.
Okay.
So there's two ways to get rid of gum disease. Either you treat it, if it's treatable early on, or you get all your teeth out. Once the teeth are gone, gum disease is gone forever. The bone damage. See, that's the thing. Well, we'll get off on a different subject, but gum disease, you know, the problem with gum disease and decay and all that stuff, it's silent. It's a silent killer of your mouth. You don't even know you have it.
So this ends all that?
It ends all that. You're done. So
breath gets better?
Oh, yeah. I mean, it's instant. So things, I mean, little things like breath odor, you know, it doesn't matter once you get this, like if you have gum disease, you can scrub your teeth with the best toothpaste brush out there. It's not going to fix it.
So the gums get nice and healthy again?
Yeah, they get beautiful like it never happened. And so what if there's not enough bone? Let's say we can build it back.
So things you can do.
Yeah, we just pour. I tell people we're just going to pour new concrete for a new foundation. That's it. It's very easy. Good. Wait a little bit, then we can still do it. Very few people cannot have it done. Very few. I'd say probably 1% of people in my office, just maybe less than 1%.
So in recent memory, you've never had to say there's nothing we could do.
Right.
Okay. Good.
I have had to say it though.
Okay.
Because it was just, beyond. They'd waited too long. Let's put it that way. That's another thing. People that start having these problems, don't wait. That problem doesn't go away. It just gets worse. So mitigate the problem, get your teeth out, and get onto this quicker. That way you'll have a better chance long term. Okay, here's another one. Just take a look at this. Now, here's a woman that came in. So her only option was a denture. As I told you, nobody wants dentures in them. They just don't want them. Now, I mean, sometimes they have to have them, but nobody wants a denture. We all know they don't work. They slip and slide. Now, here's the key thing. Once your teeth are out, remember we talked about gum disease killing your bone. Once your teeth are out, gum disease, and that goes away, but your bone starts to deteriorate. It shrinks.
Okay.
The implants stop that. So that's another key point.
Well, the pressure.
Huh?
The pressure from chewing and keeps that bone healthy.
Yeah, so the implants serve two purposes. To hook teeth on, also it preserves your jawbone. But look at her after. You can see she's much happier. I mean, look at that.
Looks good.
I mean, it's the same thing every single time. I can predict when somebody comes in and tells me their sob story. You said I smile sometimes. I actually get excited. My tears are from joy. Their tears are from sorrow because I was excited because we get the result every single time. It doesn't matter.
So when you see this woman on the before, you kind of see that
I can visualize it.
You can visualize that.
I'm the architect. I can see this beautiful house that we're fixing to build or whatever. They can't see it. They can't see the vision.
When they look in the mirror, what's that like?
Before or after?
After.
Oh, it's insane. I mean, they start shaking, their lips quiver, they start crying with joy because they get to see it the very next day and they're like, oh my goodness, this is insane.
She looks younger.
Yeah.
Did they get to pick the shade and the color and the shape or any of that? Yeah,
they get to participate in their, we do custom, later. They get to participate in all that.
Okay.
They mainly pick the color and this and that, and then we play around with it. So we customize. We just make the teeth and make them have them. We build them.
Okay.
So here's another one. Now, I said we're getting a younger generation. It used to just be people my age and older, but it's not uncommon to have nice young people like this. You can see this young lady, beautiful young lady, her teeth, I mean, she was headed for dentures. At that age group, there ain't no chance she's getting dentures. I mean, what do you think that would do to her entire outlook on life?
Are there people this young with dentures?
Unfortunately, yes.
Okay.
The fact of having dentures, what would that do for her esteem? I mean, it'd
be terrible.
Terrible. I mean, just think about job, getting up, going out with her friends that don't have dentures or dating. I mean.
So in this after, and it's dramatic change, it looks like veneers. So it's like cosmetic dentistry in a way.
But it's a brand new set of teeth.
And those can last for how long?
Oh, decades.
I mean, if she takes care of them, they should last as long as regular teeth. Is that true?
Longer. I mean, what's going to go wrong with the implant themselves?
Well, you got to clean them. You got to make sure they're clean.
Maintenance, but they last a long time. Okay, here's another one. Check this out. I mean, look at this lady. Can you imagine? I mean, here again, the same old thing. They just look in despair. They're struggling to smile. You can tell. I mean, we have to tell joke. I'm a terrible joke teller, but we have to tickle them or something to get them to smile. But when they come back, look at her. You can tell she's smiling for real. She's joy. She feels good. Look at her hair. That's another thing. Guys and women. Guys will shave their facial hair because they use it to cover their old smile.
Okay.
Or they'll get their hair fixed. Or women always get a different hairdo. And I've had people come in my office 6 months, a year later for their maintenance. I didn't recognize them. I had to look on the thing and find their name. It's like, really?
Wow. So this woman, by the way, she was also like headed for a denture.
Guaranteed. The teeth were going to come out.
That's a pretty smile, by the way, on the after.
Yeah, it is.
I'm not trying to side with you. I think anybody watching this, I'm just asking the questions. But this is really a dramatic change.
Big one. And you ask about heading to a denture. Let's face it. What if you had to have a root canal and a crown on most of your teeth, and the only alternative before was, if it wasn't a denture, it's a partial denture. It still comes in and out, and it catches. It's a mess. So if you can get this out, get dentures. Get dental implants with the teeth on them. It's the best thing. It's very quick. It's like you come in literally, in 2 or 3 hours, you're out with your new set of teeth. Come back the next day. You can start eating a modified diet immediately, and then in the future you get brand new ones. It's just going to be there for a long time.
Very nice.
All right, here's a young fella. And
These are
here
young
again,
people.
nice looking guy. He just has a terrible smile. And he was headed for a multitude
He's
of
more
things.
handsome now with those new teeth.
Way more handsome. Way more handsome. It just makes sense.
Well, you said a smile is more attractive than a frown. I think everybody would agree with that.
Way more attractive. It's just that secret. I said this before. A lot of the people, they know something's wrong. They really do. They know their smile's messed up. Here's the thing that they don't anticipate. That unlocks something inside of them. Once they get their teeth done, this little energy source just comes out.
Like the charisma comes back.
And they become just a different person. They're just so different in the way they even come into the office. They got a sparkle in their eye. They have a gleam on their face. They have a different step in their.
Are you still surprised after all these years? Like sometimes where, like you knew it was going to be good, but you had no idea how life-changing it would be?
I'm not surprised ever anymore because it happens every single time. Now, see, when I first started doing it, I did it because it was a cool thing. And that's why I got all this passion for it now, because I started seeing the life-changing event. I love doing this.
So it's a big deal.
Look, I've been practicing long enough. I could probably retire right now, okay?
Yeah.
I've been very blessed in my business. I can't retire because this drives me.
Because you like it.
To know a person comes in that I'm able to help change their entire life.
Good.
I mean, the stories go on and on and on. We'd have a whole show on that. Okay, here's another. Here's another one. Now here's good. Here again, the guy's not an older guy, but you know he needs some help. He looks rough there, you know, and look at that, a beautiful smile. I mean, what do you think?
You can imagine on a job interview.
Yeah, he goes out to get a job with wherever. Here again, it's not fair, but people see that. What do you think the chances of getting a job or getting whatever it is that you're wanting to get or get better in or get a promotion there? Okay. Here, now this was pretty wild. Now you can see this lady is absolutely faking the first smile. She doesn't even know how to smile.
Wow.
She doesn't know how to smile. That's all she could do. You know that. But look at the second one. A different person. That looks like two completely different people.
They look natural, by the way. I feel like I could spot fake teeth walking down the street. But these look real. I think everybody would agree with that.
Yeah, so that's why we custom make. Yeah,
so is it like computerized design?
A lot of it is, but I have a master technician that's done this a really long time, and he's just great at designing.
So they're like artists in a way.
Yeah, this guy is.
Okay.
I take part in it too, and the thing is, I don't want in my community for people to say, "Oh, I know where you got your teeth." I mean, people don't realize there's men's teeth, women's teeth. There's different types of teeth based on your ethnic background, the fact your gender, your facial structure. There's not just 2 or 3 sets of teeth. There's a whole bunch of kinds of teeth that go with each person.
Good.
Yeah. This is a gray one. That's a gray one, before and after.
And these are young people, and every one of these people.
Yeah, this guy's in sales.
An option would have been a denture.
Yeah, let me tell you what he said. He's in sales. Okay, he knew he had to do something. I happen to know this fella. His sales, once he got his new smile, have gone through the roof. Because
of teeth?
Here's what he said. People trust me better when I go into sale and talk to them about a solution than before. So it builds
probably confidence is better.
Well, yeah, but the person they're talking to, here again, they're not being
credibility.
Judged. Yeah, credibility.
Good.
Here's another one. Same thing. You know, nice lady. Head for denture. I mean,
I'm surprised that young people have teeth like this.
Yeah.
So this is common. It's just
more
they don't smile, as you say, so you don't see it.
It's more common than you think. You know, with all the sugar drinks and all the stuff that's come up, you know, it starts, they find themselves in a situation, they're kind of in a rock and a hard place, and they know they have to do something, and they see the value in getting this done. So, hey, how nice is it? You come in, my anesthesiologist puts you out, you wake up with new teeth. It's that easy.
So you have a medical doctor that's going to give them like IV sedation.
Yeah.
Is it true they almost have no memory in some cases of the procedure?
Who wouldn't want to be sedated for that? Now, some people don't, but most people do. Yeah, they come in.
Not just a pill, because a lot of guys doing just a pill.
No. I chose a medical anesthesiologist because that's all they do for a living. Every Thursday, remember? Every Thursday he comes in, we do this all day long.
Good.
And here's one last one. Here again, another man. He's probably more middle-aged, and here again, same thing. I mean, just think about the desperation or the feeling or whatever's happening. Not only just not being able to eat. I mean, I couldn't imagine not being able to eat peanuts and chips and steak and pizza and things that I we take this for granted. And here's the thing: people that teeth get bad over time, they forget.
They forget what they
couldn't do, because it's a gradual decline. Then when they get this, they start discovering everything new.
Like they don't even realize how bad it was
until they get
a new teeth.
Unless they're down to their last 2 or 3 teeth.
Yeah.
Their body just has learned how to get along with it. So they discover just a new life. I mean, they discover new opportunities, and sometimes it's very quick, sometimes it's gradual, but it's kind of like they've been in a let's pretend like they've been closed up and locked up in their house for 10 years, 15 years, 20 years. And they finally come out, and the world's changed, everything's different, and they're like, whoa.
Really? Is that an exaggeration?
No.
Or this is kind of what patients tell you?
Well, it's the same. I'm telling an analogy. It's kind of like they've been locked up, and they've just been in this place.
Because they're ashamed of their teeth.
Yeah, not only not being able to eat, but they're ashamed of their teeth. They can't do this. So when they get this, it's like walking out into a new world. Everything's new. The possibilities are endless, and they go for it.
We're out of time. Final message to the 2 groups. Maybe they're wearing a denture. Maybe they have really bad teeth and gums. They've heard what you had to say, but for whatever reason, they're still putting it off. They're stuck. What do you say to them?
Well, what I say to, if you're just tired of being tired, come in and talk to me. There's a reason. So if you want to be able to eat what you want to eat, be able to smile with confidence, have something that works. I mean, if you're facing a giant, big, expensive treatment plan, or maybe you're just tired, some people just get tired of putting money into putting out the fires. Maybe just get a once and for all fix. It's like real teeth. So you'll be able to eat better, you'll be able to enjoy better things, you'll be able to smile, your confidence level is going to go up. If any of those things are holding you back, anything like that, even in the very back of your mind, just come in.
At least come in for a consult.
Yeah,
Do they get to meet you, by the way, on these consults?
They meet me every time because I want to meet them. I want to form a relationship so I can understand the person, because I am their architect. We're going to build something together.
Are spouses coming in like together to do this? Like the husband goes in first or the wife goes in first?
I have husband and wives do it together.
Really?
A lot.
Okay.
Yeah. So they're both at that point. And they're just, I've had them come in, they're renewing their wedding vows and stuff, and they're ready to get their teeth fixed so they can do the next 25 years, whatever.
Very nice.
The stories go on and on. So anyway, if you're suffering from a cracked, broken, painful, decayed teeth, can't eat, slipping and sliding dentures, painful dentures, whatever it is, this is a solution. It's 2022, by the way.
Yeah.
Everything beyond this is new. This is it. It's been coming for a long time, but implants are here to stay. They are the solution for lots of things. I do all the other dentistry too. I'm not suggesting you pull good teeth and put implants in, but implants make sense. They're in. They don't decay. They don't hurt. They don't feel hot and cold, but they hold teeth just like real teeth that you can really work with.
Good for you. Well, thank you for coming on the show. Good stuff. Always a pleasure.
Always a pleasure. Yeah.
Thanks for coming on the program. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.